Hi. So today we are going to discuss regarding detail of Jatamatra Paricharya Upakramas, what kinds of Upakramas we are need to follow after the baby is born, or neonatal care procedures, etc. Right. So one by one we will see it in detail. Shiro Pichudharanam, Nabhinal Chedana, Nabi Sechana, Prashana, Snana, Rakshakarma, Stanyapan, etc. All things we are going to see it in a detail one by one. Right. First procedure or upakrama is a nabhinal kartana, right? So what they have given, we will see after the prana pratyagamana vidhi, right? What is the prana pratyagamana vidhi? In last video we have seen that prana pratyagamana means doing the procedure which takes the baby to its normal form or back to its life, right? Prana means life and pratyatmagamana means regaining or taking to its normal form, right? So after the prana pratyagamana vidhi, Vaidya should do nabhinala kartana. What is that? The cutting of the umbilical cord, right? So they have given nextly nabhinala kartana is the process of detaching of the newborn from the mother. So how we will do that? By cutting the umbilical cord, right? So they have given that detaching the newborn from the mother, as there is a flow of blood from mother to newborn, though nabhinal throughout the umbilical cord. So it is a cutting. First procedure is an nabhinal kartan. So cutting of the umbilical cord. It is not wise to separate the newborn from the mother up to the swastibhuta avastha, which is a swastibhuta avastha means which is a suitable avastha or normal avastha, right? According to Acharya Charaka and Sushruta, umbilical cord is a cut at the distance of ashtangula. According to Charaka and Sushruta, they says that ashtangula, that is 8 fingers, right? Distance from the umbilical cord is cut from the 8 fingers from the nabhi. From the nabhi, 8 fingers distance or 10 centimeter approx distance, we will cut the umbilicus, right? Umbilical cord. In between, 2 knots are tied, that is sutra. In between we have just 2 knots on the either sides and cutting in between, right? But Acharya Vagbhat what says that suggests nabhinal kartan at the distance of the chaturangul, that is a 4 fingers or around 5 centimeter approximately. Charak and Sushruta has told that they have tells us that cut the umbilicus from ashtangula, but Vagbhat says that chaturangula, right? So this is the first procedure of nabhinal kartan, right? So next we will see regarding snana. What they have explained in snana, after the nabhinala kartana and nabhi parishechana, bath the newborn with the kashaya ras, right? That is a decoction made up of what? The kshirivriksha. The which kshirivriksha we will take? They have given examples of udumbara, ashwatha, nyagrod, the plaksha, and parish, etc. Things we will take as a kashaya drupya for the bath, for bathing the baby, right? Or otherwise they have taken that sarvagandha dravyas, right? Eladi gana dravyas we can take, or kshira vrikshadi we will take, or otherwise sarvagandhadi dravyas we will also take, right? So warm water with the help of the heated with what they have given some procedures regarding how the water should be warm, right? They have explained that water warmed with the help of the heated silver or gold sheets or kapitta kasha is also useful for the bathing the newborn. We have to do hot water with what? Silver or gold. After the taking hot water for bath, after the making the water hot, we will take for bath. Otherwise they have given that what they have given kapitta kasha is also used for the purpose of bathing. These all the dravyas and metals have a kashaya rasa and shita virya. Why we will providing that? Because they have kashaya rasa and virya is a shita, and gandha which is a useful to remove unctuousness, and they also provide some gandha which is a remove unctuousness from the body of the baby and afford good smell by removing odor of the amniotic fluid. We will after this what will it does that remove the unnecessary smell from the body of amniotic fluid from the body of the baby and gives a particular type of odor or good smell to the body of the baby. Acharya Charaka stated one more vidhi. They have given, Acharya Charaka has given one more vidhi, which is that udaka grahanam after snana. which is giving some food or water to the baby after the born. After baby is born, udak grahana, after the snan. What udak grahan includes washing or cleaning of the malamarga. Why we will provide it to the baby? Because it cleans the malamarga. External orifice, example anus, urethra, meatus, eyes, nostrils, etc., will clean with the udak grahanam. This procedure will help for the cleaning of the external orifice, which is anus, urethra, meatus, eyes, nostril, etc., will be clean with that procedure, right? As there is a cleaning of the malamarga in a snana after what they have given another acharya's explanation, as there is a cleaning of the malamarga in a snan. Other acharyas have not explained, only Charaka has given the udaka grahana vidhi, right? So other acharyas has not given any another procedure for the cleaning. Vaidya can use warm or cool water for snan according to Rutu, but most wisely what they say is we can use both water, as you use cold or hot water, but use of the warm water is always better, right? So always better what warm water is always advised. So to describe the ushnodak snan in the ekantapathyadam vihara. So should describe what Ushnodak Snan in Ekantapathyadam Vihara. For bathing the newborn, one should always use warm water, and there is a why always use warm water? Because there is a chance of a hypothermia if the cold water is used, right? So we have understand two kramas, that is a Navinalakartan and second is a Snan. This is a krama, which first we have to do the Navinalakartan, and then we have to do the Snan, and third is a Shiropichu. We will see it in detail. Next procedure is Shiropichu. Keep cotton gauze soaked in oil. We have to take a gauze of the cotton or a round ball of the cotton which is soaked in oil, grita or any other sneha, and placing it over the talu or shira, anterior frontalis or posterior frontalis. We have to take or put it into the on the talu after the snan of the baby, right? It's the easy procedure. Take a gauze of the cotton, dip into it grita, oil or any sneha dravya, and place it over the which area? Anterior frontals or posterior, that is a talu or shira of the baby, right? After snan or bath. When we have to done it? After the baby has been done bath or snan. With the right index finger, Vaidya should elevate the palate of the newborn and then kept Shiropichu over the head. After what we have to do with the right index finger, we have to elevate or sensitize the palate of the baby, right? And after that we will place that gauze on the palate of the baby. According to Ayurveda, Shira is, we know that Uttamanga and sight of all Indriyas. Head is very important, right? Therefore, Abhyanga or Snehan of this part, since the birth is important, we have to do Abhyanga and Snehan, right? Because it's a very important part of the body. According to modern pediatrics medicine, significance of this vidhi can prevent hypothermia. Modern also has given opinions regarding this procedure. What they have said is that according to modern pediatric medicine, significance of this vidhi can prevent hypothermia, which is a low body temperature, right? It can be prevented through this procedure, as head have a large surface area as compared to adult, and Shiropichu prevent loss of a heat from this large part by means of evaporation, right? So what it can do, it provides the heatness or soothingness to the body and prevent the evaporations of the loss of the heat throughout the evaporation, right? In a recent pediatric practices, also covering head of the newborn with the cotton. You see the modern practitioners also use this kind of practice. What they use, that head of the newborn is wrapped or covered with the cloth or cap to prevent heat loss. But Shiropichu have additional advances of the smearing of the oil. They only wrap the cotton, but in Ayurveda, what we used, oil or ghrita, they have another extra property, right? Vriddha Bhagbhat what says, in addition to suggest keeping the cotton or cloth soaked in oil or ghrita etc. in the ear canal of the newborn, it will helpful for what? It gives clearly listening, etc. properties, and will help body to elevate the dosha, right? So next point is a Medya Yoga Prashana. Medya Yoga Prashana. What they have explained in this point, that after the birth, newborn should be given the Medya Yogas which enhance the Bala. We know that Medya Dravya is what they do, increase the Bala, that is immunity enhancement, gives life increases medha, that is learning power and memory power, etc. of the baby. So providing the medya dravyas or medya yoga after the baby is born is a very plays a very crucial role in that, right? So which yogas we have to use? That medya yoga is Ilendri, Brahme, Shankapushpi, Indri, Brahme, Shankapushpi and Vachakalka along with the Ghrita and Madhu we have to use, right? This combination we will use. Or second combination also they have given, that second Medya Yoga is a combination of Brahmi, Bala, Ananta and Shatavari. This combination also will be used, right? So next they say the newborn is a dependent for medicine, so the drug should be administered to newborn in a leha form, that is a lincture forms, because he has not capacity to bite or chewing the medicine, right? So we have to give it in a linctus form or leakable form, right? So Ghrita and Madhu act as a carrier for the drug and help to make it a leha, right? So that is a Medhya Prashana. So next they have given another property of what? Ghrita and Madhu. This says that Ghrita and Madhu have their own actions on the brain. One should administer the leha in the dose, that is a matra of Harenu matra, that is 375 mg to the newborn babies. Leha should be administered with the tip of the Ashwatha Patra. We have to use Ashwatha Patra, which is made up of a gold or Swarna, right? So leha should be administered after the Abhimantran, that is reciting some Vaidya reach mantras loudly around the baby, right? Acharya Sushruta has given 4 numbers of the Medya Yoga for lehan of the baby. According to Sushruta, what they say is that piece of a purified gold is rubbed over the stone. They have given some procedure regarding that. Piece of the gold which is rubbed over the stone, special stone used for preparation of a sandal temple, right? So this kind of stone, on that pure gold is rubbed with a drop of water, and then addition of the cow's ghee and honey is used. First we have to do that, taking a stone, but which is a special stone used for preparation of the sandal in temples, right? So this stone is taken. After that, rubbing purified gold over that with addition of the drop of water, and then addition of what? Cow's ghee and honey, etc. things, combinations, followed by with what? Mixing of all the materials, right? Such a process homogeneous emulsified colloid mixture of the fine gold particle, water, cow's ghee and honey. This combination should be then licked by the baby with the ring finger, right? Ring finger. Such administration of the gold is called as Swarna Prashan, which is a very famous preparations in Ayurveda, right? So we have to prepare that and given to the for the licking purpose to the baby, right? So Swarna Prashan should be followed by what? Stanyapan, that is breastfeeding. These combinations will be given Stanyapan plus Swarna Prashan, right? Vagbhat given Swarna Prashan along with what? Medya Yoga as a Swarna, Vacha, Brahmi, Swarna Makshik and Harita Kichurna mixed with Ghrita and honey, or Amla Kichurna and Swarna mixed with Ghrita and honey. This combination should be given according to Vagbhata, right? So how to administer the Swarna Prashan we will see in the next passage. Or administration of the Swarna Prashan, that they have given importance of Swarna Prashan or what it does to the body. So it boosts the digestive capacity and it is essential for what? The healthy growth and development of the baby. So Swarna Prashan is helpful in what? To improvement the complexion of the child. What it does is play a very crucial role in the development of the baby. First, it increased or boosts the digestive capacity. Then it is essential for the healthy growth and development of the baby. Then it helpful for what? Improve the complexion of the child and gives a fair complexion to the baby. Also, what it does, it is helpful to increase the grasping, analyzing, thinking and memory power of the child. These all things will be does by the administration of the Swarna Prashan. Right. So with the application of the Swarna Prashan, what we do, one can protect the child from evil. Only external application, what it does, that protect child from the evil spirit, etc., and makes the child strong enough to resist against the microbial infections. These are the crucial roles played by the Swarna Prashan. This is a very important preparation. From spiritual perspective, Swarna Prashan is said to be holy, sacred, and give the strength and longevity to the baby. Here Acharya has given Acharya Kashyap what this says: if one administer the Swarna Prashan for 1 month to newborn, right? Who administered 1 month to newborn baby. Then that baby become a very brilliant. If the newborn is conceptions till the 1 month, what it become, then the baby become very brilliant in the future. And administration of the Swarna Prashan for the period of 6 months, we have consumption given what combination of the Swarna Prashan to the baby for the 6 months of period, and then the child become a genius, right? So then the child will become a genius. He's a highly intellect, very strong grasping and memory power, so that he can remember the things with a single hearing or reading. Only after the hearing or reading the things, he will single-handedly remember that thing, right? So briefly, Lehan Dravya has a rasayana property and useful for nutrition and immunity help. Start swallowing and movement before the starting of the Sanyapan, it should be given. Some scholar consider Swarna Prashan as Ayurvedic immunity enhancer, right, in a baby, right? So we have seen administration of Swarna Prashan point. So next we will see what is the Garbhodaka Vamana. So what is a Garbhodaka Vamana? In intrauterine life, fetus aspired and swallowed the amniotic fluid, right? After the birth, some amount of garbhodak, that is amniotic fluid, present in the amashay, some fluid also present in the stomach, correct? So newborn may regurgitate this fluid, which is then aspired in a respiratory tract, right? If the fluid goes into the respiratory tract, definitely it's going to cause the complications, right? So aspired in the respiratory tract and interfere with the process of respiration. In order to prevent these circumstances, Vaidya should has to Garbhodaka Vamana Vidhi with what? Saindhava and Sarpi. So while thinking about the respiration, which is a very important procedure in a small children or a baby, so kind of with regarding that, we have to we can say that avoid the problems regarding the respiratory problems. So we have to done Garbhodaka Vamana Vidhi with a Saindhava and Sarpi. By this combination, so Vriddha Bhagavad says that after the Vamana there is a Shuddhi, clearance of the Uraha and Kantha, and newborn feels Laghava after which produces Abhilasha for Stanya, that is appetite. So after this procedure, baby feels lightness, comes Laghavata in Urakantha and feels lightness in the body of the baby, right, which is produces the Abhilasha, that is a appetite of the baby. Some newborns swallow or regurgitate the saliva that may block airway. We know that born babies swallow or regurgitate the saliva and that may block the airway, Ura and Kantha, to clear the way of Garbhodaka. So for the clearance purpose, Garbhodaka Vamana Vidhi is done. With the Garbhodaka Vamana, Stanya Shleshma get removed. With what Garbhodaka Vamana, Stanya Shleshma gets removed from the mouth, and therefore the Kshuddha Pravritti, that is feeling of appetite or hunger of the baby, will get increased, right? So this is a Garbhodaka Vamana and its importance. So next is the Jatakarma. We will see what is Jatakarma. We have already seen in the last video or 2-3 videos what is Jatakarma. We will just read it out. So in Ayurveda believes that Adhyatma, we know that Vedokta Karma, Acharya narrates that Jatakarma. According to Acharya Charaka, Ghrita and Madhu mixed with what? Stanya should be licked to newborn for giving licking purpose to the newborn, and Vaidya or father of the baby has to recite the mantras in the ear of the newborn along with the licking. So this is a procedure taking a Ghrita plus Madhu, and which is mixed with what? Stanya, and given the combinations for the baby for the licking purpose, and the Vaidya or the father of the baby should recite the mantras in the ear of the newborn for the karma will happen, so baby comes to its normal form, right? So with Acharya Sushruta stated that Ghrita and Madhu combination, the Acharya Sushruta only had given one extra dravya or combinations, which is Ananta Churna, should be used for licking purpose and given with the right finger of the nail hand, right? So this is a Jatakarma. So next point is the Stanyapan. What is that? After all the procedure, we had done all the procedures one by one. Then the newborn get familiar with the environment. After that, baby is getting comfortable with the external environment, right? Also, and also as stated by the Vagbhat, what Vagbhat says that Garbhodaka Vamana newborn feel hungry. So hunger has been started or feeling of the hunger started in the baby. After that, for that, the newborn should be given diet in the form of a stanya. We know that baby only drinks milk, so in the form of a diet we have to provide it, right? So according to Acharya Charak, what says Charaka, stanyapan should be started on the day 1 of the life. Here two acharyas has been given different two opinions. Acharya Charak says that it should be started on a day 1 of a life, right? First day. But while Acharya Sushudan Bhagavad what says that suggests that breast milk should be given or started from the day 3 of the life, not in the first day. Charak says it's the first day, but Sushruta and Bhagavad Acharya says that it is a started or suggested in a day 3 of life. Why? The reason they have given that the mother do not have secretions on early days, that's why it could be recommended at the day 3. After 3 days, Hridayavastha Shira, which is mammary glands, gets Vivritta, that is the dilatations, right? It get dilate, Vivrita. That's why they have given explanation regarding the day 3 for breastfeeding of the baby. What after right? So the secretions of the breast milk after 3 or 4 days of the prasuti is adequate to meet the hunger of the newborn. So only 3 or 4 days after the prasuti or delivery, the female will produce the kind of milk which is meet the hunger or fulfill the hunger of the baby, according to Charaka and according to what? According to Sushruta and Bhagavad, right? So they have provided explanation regarding that. On the first 3 days after the delivery, Sutika, that is a mother, do not have milk secretion. The mother have not more secretions of the milk. Therefore, on the first day after the prasuti, Vaidya should give Ananta Churda mixed with the Grita and Madhu to the newborn 3 times a day. We have to give what we have to provide. Ananta Churna with the Grita and Madhu according to Sushruta, right? Here Ananta is a Shweta Durva according to Arundatta, while some scholars consider it as a Durlabha. Right? Vaidya should recite the mantras while giving the leha. We know Ayurveda has a more importance given to the shlokas and reciting the shlokas while doing any procedure. So here also we have to recite the mantras while giving the lehana. According to Acharya Kashyapa, child with a good Agni digestive capacity and hunger is indicated for lehan. Only the child who has a good digestive fire or kindle digestive fire, we have to give lehana karma. And also they have given, and also the child whose mother have a very little breast secretions or no secretions should be given the kind of combinations of the dravya for which meeting its hunger, right? Then they have given immediately after the birth, mother has a very less or no secretions of the milk and the baby is hungry. Then in order to meet the demand of the newborn, one should apply lehan in the classical way. So if the at the time of breastfeeding, if the mother has not secretions which meets the hunger of the baby or very low secretions, we have to give the combinations in preference to the or meeting hunger of the baby. Newborn is newborn is able to lick only, which unable to chew, right? So to prefer sweet taste, so lehan added with a grita and madhu is a good choice. Honey helps to make lehan liquid and sweet in taste, while a grita, what does it add? Nutrition to the choice, right? Honey, and nutritional value to the food. What grita adds nutritional value. Newborn should give Ghrita medicated with the Lakshmana on a 2nd and 3rd day, right? So they have given an explanation regarding why they have chosen or what kind of things we have to do. We will just see important points, right? So newborn contraindicated with Stanyapan day 3. Why? Because no more secretions has been present in the body of the mother, so it could be avoided or contraindicated. Next, this is that the maternal milk is the best food for the newborn babies unquestionably, and it is the best ever food as well as a remedy for the growth and development of the baby. Therefore newborn should be given exclusive breastfeeding only, no any other combinations. But if the secretions are very less, we can provide the combinations given by Acharya Sushruta, right? So they have given regarding explanation regarding that, and how Prakriti and Vikriti and Prakrita Nimitta of Sanya and proper nutrition and maintenance of the health of the baby, which things we have to do or what kinds of Dhatri has to be explained has given in this paragraph, right? So we have seen that. So next we will see Stanya Shuddhi, which is also called as Stanya Sampata. We will see it in detail. Which female or milk is called as Stanya Shuddha or Stanya Sampata, right? So Stanya should be Prakruta Varna. It has to be Prakruta color, which Prakruta color, rasa, gandha, sparsha, etc. things has to be Prakruta, right? So how we will says that this is a Prakruta or a Stanya Sampata Dravya after pouring in water. If we have taken a milk and added water to it, the Prakristanya or breast milk immediately get mixed with it. It not shows any difference between water and milk. It get immediately mixed with it, right? So Prakristanya is a Pandura or Shamakavabhas, right, in a color that is a pearly white in color, which is a pearl color. It is a color like a pearl white. Madhura rasa pradhan, it has a madhura rasa pradhan and kashayanu rasa in a taste, like a kashay taste, little kashayanu rasa taste in a taste. And avivarna in a nature, such stanya or breast milk increases what it increases the strength of the baby and gives life of the newborn. So they have given explanation of the regarding touch of the baby, seeing baby, even thinking of the baby is responsible for what the secretions of the milk. And affection with the newborn is the main cause of the continuation of the secretion from whom, the mother. Even touch, seeing, thinking of the baby, which is responsible for secretion of the milk, and affection with the newborn is the main cause for continuation of these milk secretions. So Acharya also described the stanya or breast that is ideal for a feeding. They have given, even they have explained which breast we will say ideal for the feeding. We will see it in detail in the next form or video. Child takes milk through the breast, therefore not only stanya but sthan also is important, right? Stanya or stan also is important. That is, even not only breast milk but breast is also important, which is a location also important. It has to be proper, that is a stanya sampata. Breast should be of a proper size and proper shape, not too large or not too small breast. It also affect the feeding, right? Areola, which is our external covering of the we can say breast. Areola should be yukta pipalika, have adequate montgomery's tubule, which is present on the upper side of the nipple. We can say upper side of the nipple, which is which have adequate Montgomery's tubules, which is present on the upper side of the nipple, right? So sukhaprapano means newborn can easily suck the milk from which has to be the proper length, which is a suckable nipple, right? So which is called sukhaprapano means newborn can easily suck the milk from it. So right, we have seen all the points regarding this, right? So tomorrow we will see what kind of a dhatri has to be and what are its qualities and characteristics, right? So thank you.